Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 783,589 confirmed cases of COVID-19 in Canada and 270,180 cases in Ontario. Chatham-Kent has 1,219 cases and Sarnia-Lambton has reported 1,842 cases. Michigan now has 561,307 cases, with 28,779 cases in Detroit. Today, we are reporting 35 new cases of COVID-19 in Windsor and Essex County. 8 are close contacts of confirmed cases, 5 are related to outbreaks, 5 are community acquired, and 17 are still being investigated. We have had 12,194 cases since last March. 11,372 cases are now resolved, and 496 people are active cases at this time. 72 confirmed cases are currently in the hospital, and 12 people are in ICU. We are sorry to be reporting an additional 10 deaths today. 6 are from the community. 1 woman in her 60s, 2 men in their 70s, 2 men and a woman in their 80s, and 4 people from long-term care and retirement homes. A man and woman in their 80s and 2 women in their 90s. Our community has now lost 326 people to COVID. 215 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 39 active outbreaks in Windsor and Essex County. 16 are in workplaces, 17 are in long-term care and retirement homes, and there are 6 outbreaks in our hospitals. Please continue to follow public health measures. Stay home if you're sick. Limit your close contacts to your household members only. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app. If you have any symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. Last week, the Ontario Medical Officers of Health wrote a letter to the Minister of Health and Minister of Education to express their support for reopening of school as an essential for children as community rates of COVID-19 decrease across the province. The letter of support basically echoed the updated advice of the Hospital for Sick Children and recommends that daily in-person classrooms should be the last to close and first to open. The National Collaborating Center for Methods and Tools supports the reopening of schools based on the published reports that risk of transmission from children to children and children to adults in primary school and daycare setting is low when the public health measures are in place and are followed. The U.S. Center for Disease Control in the recent publication also reinforced the importance of strictly following the public health measures and to keep schools open. The implementation of infection control measures, which are present in all Ontario schools, is critically important to limit the transmission of COVID-19 in school settings. Increasing some of the infection prevention and control measures, such as the daily confirmation of screening of staff and students, wearing masks, ensuring physical distancing, will help to keep our schools safe and open. The Medical Officers of Health also advised that more efforts are needed to close unprotected staff interaction activities such as during breaks and lunchrooms. This includes ensuring that there are no in-person staff training, meetings, or special gatherings Personal protective equipment measures for staff should be reiterated, including refreshers before returning to the classroom. All of these measures will only work when public health measures are strictly followed and the community transmission is controlled and is not worsening. We will share our local epidemiology on school-age children tomorrow morning to better understand our local situation. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. Excuse me. Doctor, thinking about resuming in-class learning for kids, do you think that the level of community transmission in our region is low enough? Is that a reasonable level for in-class learning to be considered okay to resume?
Well, as I said, there are a number of factors that we have to look into. Obviously, the rate of community transmission and how the cases are progressing in the community is a critical indicator. When some of the decisions when we made in December, we were seeing the indicators worsening day by day. And now it's the opposite. We are seeing that the indicators are getting better and better every day, and which is really reassuring for the most part. But the critical part is still, how do we keep our schools safe by following all the public health measures and reinforcing some of that measures to ensure that the school continue to be a safe place, recognizing that most of the community are still in a lockdown situation with limited interaction, limited activity that's happening. So we're looking at all of those indicators. These are all good signs, and recognizing the risk and benefit. It's always about the risk and benefit of weighing one decision with the other, of keeping the school closed to protect our kids versus ensuring that they are getting the education that they need in an in-class session. So looking at all of those things, we'll be focusing on our local epidemiology tomorrow, looking at specifically the data on that population, and that would help us understand. But generally speaking, the indicators and everything are pointing in the right direction, which would support the recommendation to keep our school or to reopen our school for in-person learning.
And what can be done to ensure that people inside schools, not just students, but staff, faculty, are very strictly following those measures in place to prevent the spread of COVID-19?
So we need support from the staff as well as from the school boards to ensure that everyone is following that. Wherever is needed, there's appropriate refreshers are happening. There are specific audits are happening to make sure that the staff are following some of these recommendations. Some of the things that we also need to look at, what we have found through our various investigation, is staff coming together for non-essential reasons in the lunchrooms or break rooms, and not necessarily maintaining physical distancing or adhering to the mask policies. So we want to make sure that those interactions, those opportunities are limited or minimized or canceled at all if possible, and maybe thinking about alternate way of how do we avoid that in-person direct interaction where some of these high-risk interactions are happening. So that's something that's happening. There is a provincial recommendations for enhancing some of those measures. The Ministry of Labour is also trying to support the school in enforcing some of these measures. And we'll be working closely with our school boards, just like we have worked in the past, to make sure that all of these measures are being followed.
Okay, thank you.
Any questions from AM 800?
Dr. Alman, I'm just wondering, how many orders do we still have in place that you have issued in Windsor-Essex?
I think right now we only have 2 orders that are currently in place. One is for the agri-farm operators, and then the second one is the one that we have issued for self-isolation. So just these 2 orders that are currently active.
For the self-isolation one that went into place yesterday, I just want to make sure I have it right. So when Teresa says there's 496 active cases, that order is mainly for those individuals and close contacts of those individuals and individuals that are still waiting for results from their test?
That is correct, yes.
Okay, that's it for now. Thank you.
Thank you.
Any questions from CTV?
Yes, good morning. Non-essential small businesses are hurting. Do you think that they should be allowed to reopen under square footage capacity limits?
Well, I think it's not what I think, it's what the public health measures are there for. Public health measures are there to prevent people from congregating together, and that's the real intent. How it's operationalized, it's a policy decision, which is something that comes directly from the province.
Okay, thank you.
Any questions from CBC?
Hi, good morning. Doctor, so as you said, the indicators are positive. I'm wondering if school reopening is announced, what do you say to parents or students who might be feeling apprehensive about returning to the classroom?
Well, I would say that I understand everyone's concerns and their risk in terms of doing their own risk assessment in making this decision. These decisions are not easy. There is no right answer, and we have said it before that all these measures, there's always some risks attached to any of these. No measures are perfect measures that will prevent everything from happening in the first place. What all these measures are designed to is to mitigate the risk, reduce the risk as much as possible to keep the schools safe, to keep our children safe. There are a number of evidence-based recommendations that came out from various institutes looking at this specific situation. Local epidemiology continues to be the biggest driver for some of these decisions and is strictly adhering to the infection prevention control measures and public health guidance for these schools. So a parent, when making those decisions, they have to look into their own risks, like what the risk that they see and how it will impact their children. For example, one child can be very good in following whatever is being told to strictly adhere to the public health guidelines, versus someone else who may not necessarily follow those guidance. So those individual decisions have to be made by the parents. From a system perspective, I think the system is there in place to mitigate all of these risks as much as possible to keep our schools safe.
Thank you. Switching gears a little bit, I wanted to ask about the idea of finding ways to get better masks to the public, or possibly double masking as a way to combat COVID-19 variants. Do you think people need better masks at this stage, or should they double up maybe?
So I commented on that part before. I think the key piece is having a mask, which as Dr. Teresa Tam mentioned, even for the general public to use a 3-layered mask and to use it appropriately. I think that's the key piece. So having a mask and ensuring that it's being used appropriately, those are the key things. And I don't necessarily think that double mask is a solution, because double masking, it changes, how a mask is fit and worn by an individual. So having one single mask with 3 layers, I think that's a good enough mask to keep you safe. But again, mask is a supplemental add-on to the physical distancing piece. Mask doesn't allow you to break those physical distancing recommendations. Physical distancing is the step 1 that everyone needs to follow, and then step 2 is to make sure that you have the mask on you to further protect yourself.
Any questions from Blackburn?
Yes, good morning. Just for respect of schools, there's been a lot of talk about getting rapid testing into school. Is that something that the health unit would be spearheading, or is that something that school boards would do?
So we don't have the details on that initiative yet. We recognize that this will be a partnership, and right now we're still waiting for some of those detailed implementation details that how it would be rolled out and for our schools in the region.
how do you think it would benefit the schools? And do you think it's something that would be like beneficial if it was like daily, or how do you think it would benefit the schools?
Well, I think sometimes these targeted testing, it helps to understand any potential concerns in any school system or any particular neighborhood. If there are any concern that needs to be addressed, it helps from that perspective. It is a resource-intensive process, and we also need to recognize that the testing that would be used is an antigen-based testing, which has its own issues with respect to sensitivity and specificity. And even if a test has come back positive, it's not a confirmatory test. It needs to go to for the PCR testing. So there are a number of things that we need to consider when operationalizing it and implementing these tests across the school system.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
AM 800?
Dr. I'm just looking ahead here. Obviously, this coming Sunday is Super Bowl Sunday, a time when people usually get together. I know you had this message back around Halloween not to get together, and people at the end of the day, some people, did not listen, and we had a cluster. I guess, what's your message to individuals for this coming weekend if they're planning to get together, because they see the numbers dropping in our region?
Yeah, no, that's a good point, Rob, and as you can imagine, I'm not even aware of what date it is today. It's just, we're just living every day as it's it's an important day. So thanks for the reminder. I think it is still really important that where we are is based on these public health measures and how we are following these public health measures. We have accomplished a lot, and I do want to see us continue to follow the trend of cases dropping down. This is really important, especially when some of the region in the province is seeing the COVID variant, and we definitely don't want to see any of these super spreader type event happening in our community. So that would be my request to anyone who's thinking of coming together to watch the event. There will be other virtual ways that people can still get in touch, have a good time with through virtual connections, and still keep everyone safe. And on the second note, I think it's also important that people know that we still have a stay-at-home order in place, which is basically makes it illegal for people to get together in number when you have this restrictions in place. So I think it is important that as a humble request, please continue to follow these public health measures, because that's the only thing that will keep us safe and will move our region forward and ease off some of these restrictions. It will be beneficial for our community, for our businesses, for everyone to start to see some of these restrictions eased, to get back to some of the economic, social, mental well-being piece in our community. So that's my humble request. But on the other note, also be mindful that we still have a stay-at-home order in place.
I'm just looking here at the numbers from October, and I know you always talk about how September and October we did pretty well in our area. Leading up to Halloween, there was four cases, 10 cases in and around that area. Then obviously that cluster happened, the numbers started to increase. If people do get together this time around, to the point you just made, you're worried we could see our numbers, since they're going down now, who knows, they can go up in a couple of weeks' time if people don't listen to the stay-at-home order and if people get together?
Absolutely, and as I said, and to make things worse, if there is any possibility of the COVID variant virus showing up in any of these events, then we are looking at a much worse situation. And we definitely don't want closures. Nobody wants that. Nobody wants this lockdown to be extended. Nobody wants to stay in with all these restrictions in place. So I really, really hope that people will be smart and they won't get together in person. They can still get together virtually. There are other ways that they can keep themselves safe, their family safe, and everyone around them safe.
Thank you.
Any further questions from CTV,
No, thank you.
CBC?
Yes, I do have one question. Dr. Ahmed, I wanted to ask about the farm worker that tested positive since arriving in our region. I'm wondering if you can provide any details about that case and whether you have any concerns about quarantine conditions or COVID-19 protections for workers more generally.
So I can't provide any specific details on the case because of privacy reason. I have already provided that there is at least one person who arrived in Canada and developed symptoms of COVID and later was tested positive for COVID during the quarantine period. With respect to people following the quarantine measures, that's something that we have raised some concerns in the past, and we have sent letters to the federal government and requesting them that a possibility of having a centralized quarantine facility for all these temporary foreign workers coming to Canada, as opposed to expecting the employers to arrange these quarantine, which some employers do well while others don't do so well. So I think it's really important that if we can alleviate some of that burden and ensure that there's a centralized process for all the temporary foreign workers to quarantine, that would be the best thing for everyone.
Thank you.
Any further questions from Blackburn?
No, thank you.
Thank you, everyone.